So, a warm welcome to all of you to today's academic program. And I understand that there are quite a good number of doctors not belonging to 30th batch. And for their kind information, this program is organized by TUNA. And TUNA stands for 30th Hands United for Noble Actions. That means we are a group of doctors belonging to the 30th batch of Government Medical College Calicut who entered the dignified, the sacred gates of Calicut Medical College way back in 1986, October. That means this is exactly the 35th year of our entering into the medical profession. Later on, the entire 30th diaspora spread all over the world, and today's speaker Pappachan is addressing us from UK, and today's chairperson Ambika is addressing from US, and there are people from all over the world, and over years we spread and people entered different areas, different specialties, and I should say everybody has become successful in their own areas. So later on, the pandemic came in, and it was a challenge as well as an opportunity for us to stay together. And we had Dr. Sri Biju, the organizer par excellence in our batch, who arranged this kind of meeting. So that in fact, thanks to the social media, WhatsApp and all these Zoom platforms, we as a batch is more well knit than we used to be before the pandemic in fact. So in the era of social distancing, as a batch, we have become more closer. And we have been arranging this kind of programs, academic as well as non-academic, musical events, dance programs, mahfils, jugalbandis, as well as academic programs. And this is one among the series of the academic programs we have been having over the last 1 year or so. And today's speaker is Pappachan, and he is from Calicut Medical College, our own batch, and he did MBBS at Calicut. He will be introduced by Sri Biju, I think. And Pappachan is talking on Tacts and Tactics of publishing a paper. As we know, the dissemination of knowledge is what makes the modern medicine practice unique compared to the other alternative systems of medicine, where there is no dissemination of knowledge, in fact. So whatever we acquire, whatever we learn, we disseminate. And there is a vast number of research activities going on all over. And these have to be published to be of benefit to the humankind at large and medical profession in particular. But the problem is, compared to the number of research input or material that is being produced, the platforms for publishing or getting these published are rather few. So if you want to stand out, if you want to be addressed, if you want to be noticed, if your research activity or research work has to be brought to the forefront, you have to get it published in some good index peer-reviewed journal. So how to get a paper published? It is not an easy task. And I know Pappachan has been publishing right from early 2000. I still remember one of his papers on leptospirosis, published back in 2004, I think. Am I right, Pappachan? Yeah. So Pappachan has been in the publication field right then. And in fact, he is one of the leading publishers from our batch. So we have the right person this evening to talk on the tacts as well as the tactics of publishing a paper. So our motto should be either you publish or you perish. So if you don't want to perish, you start publishing, and how to get your work published, Pappachan will be telling you. And I hand over to Biju for introducing the speaker. Biju.
Thank you, Gafur. I will be introducing the chairperson of today's session. Dr. Ambika will be introducing Dr. Pappachan. So about Dr. Ambika P. Ashraf. She is also the alumnus of Calicut Medical College. She also belongs to our batch. Ambika is a Ralph Rosen Endowed Chair in Pediatric Endocrinology. She is also the Professor of Pediatrics, Division Director of Pediatric Endocrinology and Diabetes. She is also the Medical Director of Pediatric Endocrinology Clinics, Children's of Alabama Hospital, University of Alabama at Birmingham. So this is in short about Dr. Ambika. Handing over the mic to Dr. Ambika for the further conduct of the session. Thank you.
Thank you so much, Sri Biju. How is everyone? Can everybody hear me okay? Thank you.
Yeah, it's clear.
It's very nice to see everyone. I'm very excited to be here and to participate in the 30th batch online get-together / academic activities. It's very nice. What I'm going to do is to introduce Dr. Pappachan Joseph, one of our classmates, whose medical and scientific career is without parallel. So it's really fascinating how time flies, because it seems like yesterday I saw him when myself and Ashraf was walking along the corridor of the House Agency Hall. We saw each other. So he's like one of those individuals known only by their first names like Obama, Oprah. He's simply known as Pappachan, and everyone knows who's being talked about. Pappachan is a consultant and lead for research and innovation at the Department of Endocrinology and Metabolism, Royal Preston Hospital, Lancashire Teaching Hospitals, NHS Trust, UK. He is also an honorary professor at the Manchester Metropolitan University. I always admired Pappachan's career, and I want to explain why. Many of us are exceptional clinicians who make astute observations and save lives. Like Gafur said, we always want to disseminate knowledge, and we do it very efficiently through our medical students, residents, and fellows. But Pappachan also takes the next step to communicate the clinical findings and deductions to the scientific community with the ultimate intention to improve patient outcomes. For example, the way a clinician sees a patient with metabolic syndrome is very different from the viewpoint of a PhD scientist. So Pappachan is one of those rare individuals who took the calling upon himself to excel as an academic clinician and contributed significantly to the scientific world. He's an eminent scholar. He has authored about 100 high-quality manuscripts. He has won numerous awards for excellence in teaching. He's an editor of several journals, including Frontiers in Clinical Diabetes and Endocrinology and Healthcare. He's just an extraordinary teacher, learner, and a sincere friend. Pappachan's research interests include obesity, musculoskeletal metabolism, and neuroendocrinology. Today, he's going to talk to us about Tacts and Tactics in academic publishing. Without further ado, I'll hand it over to Pappachan. Pappachan, the floor is yours. Thank you.
Let me try to share my screen.
No, not yet.
I think
You should be able to share now.
Yeah, okay. Can I do that?
Yeah.
Can you all see my slides now?
Yeah.
Thank you. Thank you very much, Ambika, for the nice introductions. And Sri Biju, Ashraf, Gafur, and other colleagues and classmates across the globe. Good morning, good afternoon, and good evening, because we are sitting at different regions of the world to share our experiences today. I'll be talking to you about academic publishing. I'm unsure whether I'm the right person to talk about this topic because I have no formal academic research training. I don't hold a PhD or an MD research degree. I've never worked as an exclusive clinician scientist working in clinical laboratories, although I used to do some clinical academic work in the past and present. What is my legacy to talk to you about publications today? I've done some reasonable numbers of publications in the past few years. I have been blessed to be student of many of the renowned teachers of Calicut Medical College that produced several hundreds or thousands of clinicians and academics across the globe. I'm privileged to be the student of great Professor K.P. Aravindan and great Professor V. Jayanti, my graduate and postgraduate medical teachers respectively, who cultivated a keen enthusiasm and interest in academic work and publishing. Although I didn't have a major academic affiliation in the past, though I had an offer for a PhD training in Maastricht University in 2008, I was not able to pursue the training program because of my family situation and my age. However, I've done some publications in the past, and I'll be just sharing my publication experiences with you. So don't expect a great deal of scientific content in my talk. This is my competing interest statement as part of usual talks we give. And this is the outline of my talk today. I'll be just sharing few cases with you and the initial publication experiences. And then I will give some broad formatting guidelines on forming a good quality academic paper. I'll conclude in 30 to 40 minutes, and I'm happy to take any questions in between the slides and at the end of the session to learn from you all. This is the first case, a 21-year-old woman who presented with acute ischemic stroke. As a part of evaluation, we all did clinical examination. She had mitral stenosis with atrial fibrillation, and this was the interesting observation in her cardiac echocardiography. You can see a large mass which moves with the atrial systole, partially blocking the mitral valve orifice. And you can see the video. You can see a very mobile mass within the left atrium that moves like a ping pong ball. I'm sure my colleagues, my friends, Shyam Kumar Remdi, Mubarak, and Manu Verma must be able to make the diagnosis already because they might have seen this kind of observations in their day-to-day clinical practice. Because of the unique observation and the interesting clinical images and videos, this was published as a report in the New England Journal of Medicine, the best medical journal in the world, in 2007. This is another interesting video of a 46-year-old man who presented with prolonged fever. And as a part of evaluation, we did cardiac echocardiography that shows a mobile vegetation across the aortic valve. You can see the color Doppler views and the dance across aortic valve. That was published as a report in the International Journal of Cardiology in 2008. This young gentleman, a 24-year-old person who presented with loss of libido, gynecomastia, and you can see a small drop of milk in his nipple. As a part of evaluation, we have done his prolactin level that was sky high, and you can see the pituitary image that shows a macroprolactinoma. Because of the uniqueness of this observation, I asked many of my academic colleagues and who have never come across such a man with lactation. Of course, you see a lot of cases, females with galacturia in prolactinoma, but a male galactorrhea is quite unusual, and therefore this was published in the Canadian Medical Association Journal in 2010. This is another interesting clinical observation. You can see the clubbing of toes and without clubbing of the fingers, differential clubbing. And you must have your diagnosis in hand now. Differential clubbing is a classical picture of reversal of a PDA shunt. This is one of my very successful trainees in the past who was doing MD under my training in Kottayam Medical College, Dr. Anup Tian. He is currently an associate professor in oncology in RCC, Trivandrum. He has made several academic publications following training from Kottayam Medical College, and is one of my most successful trainees in academic career. He published this interesting observation in the New England Journal again in 2012. These are the simple clinical observations we all come across in our day-to-day clinical career. And if you are able to document that scientifically, that could be a good quality publication, one of the good academic journals. So how do you begin? We should have some ideas how to document things, how to collect data, and how to form or format an article. There are different types of articles, as you can see from this slide. You should be able to do a brief literature search to have clear idea what you're going to do. You should know how to format a scientific paper, for example, an original article or a review article. And if you have reasonable language and writing skills, you should be able to make a good quality paper. And of course, most of the journals now accept submissions in the online version. So you should have reasonable computer skills to submit a paper. How do we do literature search? I'm sure most of you must be doing some literature search on your day-to-day clinical career to compile evidence on what you practice in your day-to-day medical practice. I use usually PubMed for my academic literature search. Of course, there are other search engines such as Google and Google Scholar. Cochrane Library is a very good database of systematic reviews and randomized clinical trials. You have other databases such as Embase, Kairos Corpus, or Web of Science, from where you can collect and compile evidence for your academic work. This is the front page of PubMed, the National Library of Medicine website, thanks to Al Gore, the former US Vice President, who made it free to the global scientific fraternity. If you don't know how to search PubMed in a very systematic fashion, or you don't know how to do an advanced search, PubMed itself will teach you through the PubMed tutorial. For example, I've done a keyword search today morning on the publications of Rajesh Kannangai, one of the most successful academics in our batch. Has published more than 113 publications cited in PubMed already. What type of journals you target your papers? What decides the acceptability of your paper? Impact factors are basically the number of citations of a particular journal in a year divided by the number of articles published in that particular journal during that year. This is decided by various agencies such as Thomson Reuters, and the high impact factor probably gives us a better quality journal. For example, New England Journal of Medicine currently has an impact factor of more than 85. So there are different impact factors, and if you have a publication, a high impact factor journal, naturally your article will be having better visibility to the global scientific audience. Open access publication is emerging quite fast in the recent years. Of course, these journals publish your article in full in the World Wide Web, so that any scientific professional across the globe can access it fully. However, you have to keep in mind that most open access journals demands payment for publication of your paper. So it can be slightly difficult for developing countries or if you don't have funding for your research work, you may struggle to publish because the open access fees ranges somewhere between $500 to $3,500 or euros. There are different publishing groups such as Elsevier, Springer, BMJ Publishing Group, JAMA Group. You can target depending on your choice and the quality of your paper. What do the journals need for accepting a particular clinical paper? As in any social domain of day-to-day life, you should have good quality ideas. If you have a good clinical observation, that may be acceptable to a journal. There should be some new learning points from your paper to be acceptable to any journal. What kind of ideas you need? You always don't need a hi-fi idea, such as the restriction fragment length polymorphisms of a bacterial DNA, or the ACE gene polymorphisms for SARS-CoV-2 attachment in the pulmonary epithelium. It can be simple clinical observations such as elevated JVP or third heart sound in a patient with suspected heart failure. I'm sure even a third-year medical student will give you the diagnosis if you show these clinical observations to that person. However, if you document significant number of cases with a very good data, these kind of simple observations may be acceptable to even the best medical journal in the world, such as New England Journal of Medicine. If you scientifically document in a good number of patients, and if you have a good write-up, it may be acceptable to a very good quality journal. Coming to my research experience, as Gafur was mentioning, I'm sure at least some of you from the Calicut Medical College might remember our great teacher who fell ill with human leptospirosis in 1991-92 when we were all doing our final year MBBS training in Calicut Medical College. The incident was quite scary, and I had an ambition to do some work on this topic. I encouraged one of our classmates to do a research for his postgrad thesis, but he was unable to perform it because of lack of the serology at Calicut during that period. Human leptospirosis is one of the most widespread zoonoses across the world. Many patients die across the globe, especially in South India and in our home state of Kerala. However, textbook says Weil syndrome usually occurs in the second or third week of the illness. What do we observe during our day-to-day clinical practice? What are the mortality risk factors in our region? And what are the immune phase complications in the eye that we may come across? These were some of the burning questions when I started this work as directed by the Institutional Research Committee, and I have leading this research program with a few of the colleagues and senior academics at Calicut Medical College between 2002 and 2004. We made this observation and we found that around 60–70% of patients will develop Weil syndrome within the first week of onset of illness. That was very different from what we learned from our textbooks. Therefore, this observation was interesting to the National Medical Journal of India, who accepted this as an original research contribution in 2004. We charted the pattern of epidemic leptospirosis in relation to rainfall during that particular epidemic. I went to the meteorology department, collected the data of rainfall of the whole year, and we plotted a graph like this using computer. Professor Aravindan helped me to produce this graph. And you can see when there is continuous rainfall, there is not much of leptospira. However, when the rainfall stops for a few days, the epidemic peaks. Then again, the epidemic gradually comes down, and there's a peak of rainfall in a later month. You can see here. followed by a peak of leptospirosis a few days after stopping rainfall. And again, the epidemic comes down slowly, and there's a heavy rainfall, period of heavy rainfall for a few days later, and you can see the leptospira epidemic peaks within few days. What does it imply? When there is heavy rainfall, the contaminated environment will be clearly washed off from the excreta of animals such as rats or small animals or even cows. That carries the leptospira in their urine. However, when the rainfall stops for a few days, water collects in ponds or small puddles through which the victims of leptospira walk barefooted and they get infection. So this was an interesting clinical graph and plot that we could publish this paper in the British Journal of Epidemiology in 2004. We were following up the patients during the epidemic, and we followed up 282 patients for nearly 3 years, out of whom 18.4% developed some form of eye disease during the follow-up period, implying that they had immune phenomena even after treatment. This is one of the largest data in the world as of now on treated patients with leptospirosis developing immune phase eye complication. Of course, there are papers from Madurai, Aravind Eye Hospital. Professor Ratnam and her colleagues have done a lot of work, but they don't have a data of patients already treated and diagnosed with leptospirosis. Thanks to my research development establishment colleagues at Gwalior, Professor Batra and his colleagues who helped me to do this work, and all the serological works were done by the scientific team of the Research Institute for Defense. I moved to Kottayam Medical College in 2005 as a faculty member, and we used to get a lot of snakebite envenomation during our acute medical takes. This is a common problem, not only in southern Kerala, but also in northern Kerala. And we used to have a very good snakebite ICU at Calicut Medical College, formed by our beloved former teacher, Professor CBC Warrior. As you all know, snakebite victims should get snake antivenom as soon as the envenomation is confirmed. However, most of the patients who are farmers from distant areas, they reach the hospital later and they develop complications of snake envenomation. So what we did, we entrusted one of the trainees to do a thesis work on this topic, who collected data from 204 patients. And we found that delay in administration of snake antivenom was associated with higher complication rate that we plotted in a graph like this. And you can see the renal complication again increases with time when the snake antivenom administration is delayed. This was an interesting clinical observation that was published in the BMJ journal, Emergency Medicine Journal. It's one of the highly cited papers from our previous work. Coming to the latest research, vitamin D deficiency and COVID-19. I know this is a hot topic and a highly debated topic. So I'm sorry, several of you might have suffered the difficult period from the pandemic. And I'm sorry to understand that several thousands across the globe are no more with us from the terrible pandemic. Still, we are struggling to fight the pandemic and we don't have a proper treatment. So we thought we'll study the relationship between vitamin D deficiency and COVID-19 pathophysiology. The hypothesis was that vitamin D deficiency may increase the COVID risk. We charted the data in 1,700 patients from 2 hospitals in Preston and near Manchester. And this was published in our Apex journal, Apex Clinical Research Journal of the Endocrine Society. Interestingly, we found that about vitamin D deficiency was associated with 3.3 times higher risk of hospitalization in patients with COVID-19. This article was highly taken by the global scientific fraternity, and you can see the altmetric attention score, which is quite high, probably because of the pandemic. The next group of articles are review papers. This should be on a hot scientific topic. Usual word counts is between 3,000 to 5,000. One should have an in-depth knowledge on the subject you are dealing with. And usually this type of articles are invited to the authors when they have some previous research work in the area. The usual number of references are between 50 to 100, and you should put forth some key messages to the global audience to impress the journal for an acceptance. This is one of our recent invited papers on diabetic heart disease published in April. I had an invitation from the World Journal of Diabetes, and a few of my colleagues helped to draft the paper, and we published it in the World Journal of Diabetes. You may be invited to write a best practice review in one of the good journals, as you can see from this paper in 2015. Editorials are the next group of articles to journals. Usually they are invited from scientific professionals. It should be a commentary about a hot topic, a public health issue, or a scientific research paper published in a particular journal. The usual word count is between 700 to 1,500, and you can have 10 to 15 good quality references. Incretin-based therapies, as you all know, is an important treatment options for patients with type 2 diabetes and obesity. And there was hot debate about the risk of pancreatitis in patients treated with incretin-based therapy. There was a systematic review published in the journal Endocrine in 2015. I have been the peer reviewer to this particular article and have suggested a lot of changes in the article. And the journal editors asked me to write an editorial on this topic, which I was able to publish in 2015 in the same journal issue where the systematic review was published. Book chapters, again, are usually invited papers. If you are an expert in the field, you may be invited to write a subtopic on a book, and you can format the paper according to the publisher or the editor who suggests the number of words or the references that they require. This was one of my book chapters to the Karolinska Institute in 2017. And based on this book chapter, I'm now invited to publish a test book by Elsevier on endocrine hypertension. I'm compiling papers to that book. Next group of articles are the randomized controlled trials. As you all know, these are the best quality research papers. You should have a strict protocol that is usually pre-registered. Without registration, most good quality journals now don't accept randomized controlled trials. You should register the protocol with clear criteria and the inclusion and exclusion criteria in North American or European or a national trial registry, so that the global scientific fraternity can see what you are going to do. This will probably help proper scientific dissemination and transparency of research across the globe. You should have strict criteria for sample size and screening for eligibility of inclusion in the particular study. The participants are usually allocated placebo or the drug based on computer generated random blocks. This is a consort diagram to show how strict the research protocol should be. And you can see around 350 patients were assessed for eligibility to include in the trial, of whom only 57 were randomized to the study, and only 29 received the drug and 28 received the placebo. Next group of scientific papers are systematic reviews and meta-analysis that compiles evidence from existing scientific knowledge. These publications needs very strict research protocol and immense effort from different professionals. You may be working in one institution, you may be collaborating with the different individuals from different institutions or organizations. You may be having collaborators from a different continent. You should have a strict criteria to formate and write the paper called PRISMA guidelines, which you can access from the web. And these kind of papers are usually utilized by the professional bodies and policymakers to design best practice evidence as well as clinical guidelines in medicine. This was one of the previous meta-analysis we published in JCM in 2015. When I was planning to do this work, I didn't have a good statistician in my institution, and the university demanded 185 pounds per hour of statistical input. I didn't have any funding for this work, so I contacted Professor Raman Kuti of Srithra Medical Center. He was a professor of statistics and epidemiology at Srithra, who kindly agreed to help me with the statistical work. In fact, he did not know how to perform statistical analysis for a systematic review. However, he agreed to learn this, and within 4 to 6 months' time, he learned and he performed the analysis that we could publish in the JCEM. In fact, based on the observations of this study, the current guidelines cite this paper in the Endocrine Society guidelines for management of patients with hypopituitarism. I am a Cochrane collaborator, and Cochrane reviews are basically the best quality systematic reviews. Cochrane gives the authors guidance to do research and guidance to formate the paper. And this is one of the largest scientific collaboration across the globe, having more than 22,000 volunteers across the globe who communicate with each other, collaborate to form best evidence that is at the top of the evidence pyramid you all know. This is one of our systematic reviews currently being processed for final publication in next month or so. And this is a protocol we publish in Cochrane, and this is available in the web. With that, I'll just go to the formatting guidance of how to make a scientific paper. You should have a good abstract, which is usually placed in the PubMed repository. And most journals without open access publishing option or without open access repository, the abstract only will be seen by the global scientific audience. So you have to structure the abstract in an appropriate way to have a concise picture of your data and your study results. You should have a good introduction, which gives the background of the research work you are doing with some good evidence and citations. The methodology should be robust in the paper. You should concisely describe what you are doing in the particular research. The results could be formatted in the form of graphs, pictures, flowcharts, and tables. And of course, you can write in the main text as well. The discussion should always compare and contrast your research work with existing evidence to ensure that you try to give the best evidence to the global scientific fraternity so that the article will be acceptable to the particular journal you are targeting. You should get the best quality evidence from other clinical studies, systematic reviews, and best evidence. Most up-to-date evidence should be compiled in the reference session. If you have a lot of data that can't be included because of the word count limit of the article, you can put them as a supplementary data in the online version of the journals. And most good quality journals now publish appendices of the main data that is published in the full text of the articles. You should have reasonable computer skills for literature search. You should know how to submit the paper, and you should know how to format the paper properly. And once you have the paper with you, based on the journal guidance, it's just a half-an-hour job to submit the paper, and the paper will go to the journal website. What happens to your paper when you submit a paper to the journal? Most journals have a good editorial board with scientific professionals of different domains who handles individual area of their scientific expertise. So if you submit a paper to a journal, the handling editor usually see what is there in your paper. If you have submitted a good work, the handling editor may get impressed and he or she may send this for peer review. Peer review is usually a voluntary process without payment, and it's time consuming. So unless you submit a good quality paper, it won't be even sent for peer review and be rejected from the editorial review itself. But if the editor is impressed, he may send it for peer review, and usually 2 or more peer reviewers will review your paper, assess the scientific quality, and if your observations are unique, impressive, and good to the scientific audience, they may make recommendations with some suggestions for modifications, and the journal may accept your paper. However, if the peer reviewers say that your paper is not of sufficient quality, the paper may get rejected. Don't worry, you may be able to put the paper in a different journal using the peer review comments you obtain from the journal, and that may improve the quality of your paper, and another journal may accept your paper. Which journal you target? Is it an international journal or a national journal? Many people say that international journals are better, but it need not be. And there's the barrier between the international and national differentiation is going fast, because most of our national journals from India now accept papers from different countries. For example, I recently received a research paper from Turkey, submitted to Indian Journal of Medical Research, and that was accepted by the journal. So there's no true national, international differentiation. So any journal which has repository in the PubMed or any good scientific database will have high citation rate, and the factor which decide the quality of your paper is the number of citations you receive or the impact it made on the global scientific fraternity and the knowledge base. You can choose an open access journal, but unfortunately, because of the payment required for this particular type of publications, unless you have a good funding, it may be difficult, especially from the developing countries. So what do you need to get your article published? You should have keen enthusiasm to do research work in your day-to-day career. You should have motivation to do some hard work. I know this is really hard work, but as I tell my trainees, if you spend 1 hour extra in your day-to-day clinical career, end of the year, I'm sure you will have at least 3 to 5 publications of good quality. You should have basic idea about research and statistical methods. You should have reasonable language skills and computer skills. And above all, you should have a good team to work with, and probably a support from your family that may help you to make a family paper like this. Good luck with your article publication, and thank you. I'm happy to receive your comments so that I can also learn something from you.
Thank you so much, Pappachan, for such a phenomenal presentation. It was very useful. I'm sure there will be questions. So please feel free to unmute yourself and ask questions. While we are getting questions, I would like to say some of the things that you made me remind about publishing. So for me also, it is like coming out of a robust mind, curious mind as to what are the questions that you can answer by seeing a patient. For example, a case report or a case review that you showed, that shows even for all of us could actually disseminate our knowledge in a meaningful way. So case report, case series, retrospective chart review, all of those are not complicated to write. And it doesn't take up a lot of time. It's almost like, for me personally, it is like watching our children grow or having that creativity, giving you like the feeling of plants blossoming or watching a flower blossom. So it was a good feeling, and thank you, Pappachan, for echoing those type of sentiments. And then if you could explain the difference between systematic review versus meta-analysis versus Cochrane review or a symbol review, and what's the process and what all methods do you need to use for those processes? That'll be grateful.
Ambika, can I interfere?
Pardon me, what did you say?
Can I interfere?
Yes, absolutely.
Pappachan, could you stop the screen sharing?
Yeah, okay, thank you. Yeah.
Thank you.
I'm not that clever with IT, that's the problem. Right. Can I answer Ambika's question? Right, okay, that's a very good question, Ambika. Basically, systematic review has two components. So you have the qualitative review and the quantitative review. If you have a systematic review with 10 different articles, you are assessing quality. And if you have 3 or 4 studies which have similar observations, you can try to pool the data for the quantitative synthesis. And the quantitative synthesis part is the meta-analysis. So systematic reviews always need not have a meta-analysis component, but it assesses the quality of each publication and try to compile evidence and will give a narrative, concise output of what has been there in the whole review process. Cochrane basically is a systematic review group which gives scientific guidance to the global audience, global scientific fraternity on how to perform systematic reviews. Cochrane gives training, Cochrane gives online education for the authors. It has an editorial board with a lot of scientific professionals, all volunteers technically, and who will compile the evidence and also look at the systematic review you have done, guide you to write and format the paper, and finally publish it in Cochrane database reviews. But you don't need to always publish Cochrane for Cochrane your systematic review if you have done some systematic review. It can be in any other journal. Many other journals, including BMJ, Lancet, JAMA, and many other good quality journals now accept systematic reviews. But most systematic reviews published in good quality journals are based on the Cochrane guidance, because Cochrane is probably the apex body to guide the global scientific fraternity to make systematic reviews, and they have their criteria. In fact, there's a Cochrane handbook which is accessible to all. And if you have done a systematic review in the past, you may be able to work with Cochrane to format a good Cochrane review, and then that can be published. If you have published a Cochrane review, that may improve your chance of getting accepted in other journals because you have the scientific methodology to format article. So in a nutshell, a systematic review doesn't need to always produce a quantitative synthesis in the form of meta-analysis to pool data from different studies. For example, if the systematic review has not much of studies having similar observations or comparable data to pool to form the quantitative synthesis, it may be just a narrative systematic review assessing the quality of individual articles and looking at the scientific validity of each observations and writing up the whole review as a recommendation. But if there are multiple papers in the particular systematic review that can be compiled into a single pool data, you can have pooled forest plot to give the evidence that will form a meta-analysis. So systematic review can have meta-analysis in it, but maybe without meta-analysis also. And you can also just do a meta-analysis, but basically that is based on the PRISMA guidelines to format and then publish it.
Thank you, Pappachan. And another question is, are there any reference softwares that is one is better than the other, or is any of them freely available, like to use free, or do you need to have subscriptions?
That's again another interesting question. In fact, as I have told you, I'm not a great academic, and out of my stupidity, most of the time, I will just try to get the references from PubMed directly and do it by its own. I think there are different online tools, or there are softwares for referencing and citations. I have, what's it called? EndNote. Marina was telling from the other side. EndNote in my computer, which is very good for referencing, and you can use the styles in EndNote. You have to compare those things. But looking at it, I sometimes find it slightly more difficult, because when I write something, especially an original paper, there may not be much of references, like a review article. So I usually take references directly from PubMed itself. If you just look at the PubMed search engine, it gives how to cite a particular paper. You can just import citations. But if you have EndNote, which is quite user-friendly, you can use EndNote to compile your citations, and then you can reference it as and when you are writing the paper. It will be quite easy, especially if you are writing a big review article with multiple references at multiple sites.
That's very helpful. Thank you, Pappachan. And any other suggestions for somebody who is planning to write a paper on how to formulate questions, how to change an observation into asking questions, retrospective chart review or something like that? You had alluded some of them in your presentation, and I was really impressed by the some of the articles, especially the clinical observations that you have published in NEJM and all. So any suggestions that people can use based on those type of experiences?
I think if you find a clinical observation, for example, if you are planning to write a case report, if you have observed something which you have not observed in the past, or what I would say, like Arvindan Sir says, if you have had a clinical observation, which is probably once in a lifetime, that may be a publication, definitely a case report. And if you have a clinical observation which you have made, which is different from an existing evidence in a textbook or whatever, as I have told you about the wheels work we have done, you can try to form a hypothesis that this is different from what you have seen, and you can formulate your hypothesis and work on. Don't need to be conventional. So I think many of in case reports and some of the original research, what the journals usually need is something different from what is existing. So there's a discrepancy between the existing knowledge and what you have observed. And if you just scientifically document it, it will definitely go to a good paper. For example, one of our former pediatric teachers from Calicut Medical College, Johnny Vincent sir, whenever you know him, he was from Thrissur. Johnny Vincent sir was one of the pediatric professors in Calicut Medical College and who worked in Thrissur Medical College. He has made a original observation of pediatric meningitis. If you keep the patient sitting and bend the head forward, the knee will be flexed if there is significant neck stiffness. That may be present even before the classical neck stiffness comes when patient lies down. So he made that observation. He compiled evidence based on his observation in a few patients, and he published it as an original research paper in Archives of Disease in Childhood long ago, and that was accepted as Johnny Vincent sign. So that's how scientists work, because, I'm sure you must be aware of Corrigan Science and all, who was a third-year medical student who observed something, and he scientifically documented and published, and that was become Corrigan Science. So any clinical observation you find slightly different from what you learn from your textbook can be a topic for research to look at, and then probably you can look behind or look forward to document it properly to make it an original paper.
That's a very valid point. And I can also say one of my personal experiences when I started fellowship, and lots of these questions, they seem like, for a clinician, they seem very basic. So for example, we were seeing, when I started the fellowship, it was around 2003 to 2006. So around that time, we used to, vitamin D was getting in vogue. So we used to do a lot of vitamin D in patients. And then we started plotting who has vitamin D deficiency versus who doesn't have vitamin D deficiency, and what are their characteristics. And it was interesting because we actually didn't even have a big question. We just wanted to see our patient population and their profile as to which of these patients are prone. So we learned a lot of things. Some of them were already established, like, patients who are obese tend to have low vitamin D deficiency. We also found that African Americans have low vitamin D. And so lots of these things opened our eyes, and subsequently we actually described that resulted in another prospective study, vitamin D binding protein. We started asking the question, could it be that some people with vitamin D deficiency, they have low vitamin D binding protein, which will make their functioning bioactive vitamin D actually normal compared to others? So we were one of the first few who published that vitamin D binding protein effects. So this was so similar to what Pappachan is saying. Some of the clinical observations that prompt us to write a case report, then will prompt us to write a retrospective case series, and then a prospective study. And I see a couple of other questions on the chat. So Dr. Ashogan is commenting, Mentally is a good free-to-use reference managing software. Of course, one needs to get used to it. Finally, a manual editing may still be needed. And one of our medical students, actually, he uses Mentally. I use EndNote, same like Pappachan, but EndNote is subscription. So if you're not on a university, it is very hard. So, but Mentally, that is something new that we could all use, and it is free. And anybody else has any questions or comments? So Sribuju, what's our next? Do you have any other plans for the meeting, and how do we?
No, we don't have any other plans after this. We will wind up with a vote of thanks. So do we have any other questions from the audience? Or we can wind it up. We can call it a day.
Okay, thank you. Thank you all for joining and participating. I was so delighted to see so many faces. And, if we could unmute and open and put the faces back, that would have been great. But it's really, really nice to see so many people joining for this meeting. And thank you, Pappachan, for this outstanding talk. Very nice to see everyone. Thank you.
Thank you very much.